All right, everybody. Hello, Scott here again. And I wanted to say a few words about trauma. We can experience trauma in different ways. Physical trauma, emotional trauma, some kind of a shock to the body, to the mind, which is really to both. So, in this case, let's talk about a trauma. Let's talk about an upcoming surgery, because that's an awfully good example of a trauma to the body and the mind. So, what do we all want if we're facing a surgery? We want a good outcome, for sure. So I'm going to bring up a word that was important to Moshe Feldenkrais, founder of the Feldenkrais method, and the word is resilience. So that word means just what we want. It means to be able to recover quickly. That's what we want. And it also has the connotation of being able to spring back, which is also what we want. Moshe used the word resilience in association with health. And he said something to the effect that resilience, or that health is measured by your ability to withstand a shock and have that not interfere with your normal way of living. To be able to withstand a shock and have that not interfere with your normal way of living. So in terms of what we're talking about, a surgery, that's wonderful. You have a surgery, able to find ways to withstand that so that it does not affect your normal way of living. So these are all things that we want. And this is a hopeful direction to talk about, because resilience is real. So Moshe related an interesting story, tragic, interesting, about sitting in a person's house in Paris. And this person was well-to-do, and he left the room, and Feldenkrais was left to himself for a moment, and in walks a lion into the room in which Feldenkrais was sitting. And the man comes back, and he's raised this lion. But Feldenkrais goes on to tell the story of the fact that later the lion got loose in the streets of Paris, and an older lady with not good eyesight began to chase this lion, thinking it was a pesky dog, chasing it off with her umbrella or whatever. Well, of course, that caused a ruckus in the streets. The police were called. They take the lion away, and it had been raised by this person that Moshe is describing visiting, and they were very dependent on each other. The lion was taken to the zoo, and even though the man was well off and fought to get the lion back, he could not succeed. The rules are the rules. And the lion wasted away in captivity. It refused to eat. It needed that relationship with its owner and couldn't adapt to its new circumstances. So the lion died. I think that's obviously tragic that the authorities would let the lion die rather than find some way around to do something for it. But that was the case. In many shocks in our life, as I know, can provide a loss like that, or a very difficult circumstance. So the difference between us and a lion is that we have other faculties, or other parts, other more developed parts of ourselves, of our mind, that allow us to transcend some of these things where the lion did not have those abilities. So hopefully with us, we can find the resources to be resilient where the lion was not. We are human beings. So Moshe Feldenkrais had a very positive psychology. He would say, if you know what you're doing, you can do what you want. Which is to say that if you have a problem, it's a learning problem that can be solved by learning something. So resilience means that we have enough inner resources to actually be able to take a shock, a surgery, in this example, and have it not affect our normal way of being or living. That's a good thing. We don't have to be like that lion. In fact, we can go through things with tremendous ability to learn, with tremendous resources. So how do we find these inner resources? And we just said it was by learning. So just because I say that I have or you have inner resources that allow resilience, there's still the learning process. Well, let's give a couple of examples of how you might have inner resources. So the first one, because the Feldenkrais method has been so meaningful to me, and because it's a mindfulness practice, there is a researcher named Dr. Ellen Langer who's written a book called The Mindful Body. And she's done many experiments to show that our perception and in our mindfulness influences and is strongly related to our health. Again, Moshe defined health as resilience. But however you define it, mindfulness is well related to it. So the first example is an example of someone healing, and it's an example of perception. In this experiment, they had a room full of people and another room full of people, and in both cases they inflicted a minor wound, probably a small cut. And this wound was supposed to take X number of hours or whatever it was to begin to heal. Days, hours, whatever it was. So with one group, they made the clock run twice as fast as normal. With the other group, they allowed the clock to run at normal speed. And obviously, in what I'm talking about here, the group that had the clock run twice as fast as normal healed much faster than the other group. So perception is always related to how we are in life. So that's one example of how mindfulness can affect, mindfulness and learning can affect our healing. And it's a very hopeful example. So another one is the confidence that you have in your ability to heal in the first place. Someone named Candace Bird, not too long ago, set the world record for ultras. Ultra running, if you're an ultra runner, that means you run distances longer than a marathon, which is 26.2 miles. And normally that's accepted to be the next metric distance, round metric distance, which would be 50K or 31 miles. So she ran at least that distance every day, and sometimes much more. In particular, she ran a 100-mile race in the middle of that. But she ran at least that distance every day for 200 days. That's not normal. But she did it well, and she came through it well. Then later on, perhaps 6 months or a year later, she was riding her bicycle down a steep road, that had curves in it. When she came around one of the curves, a terrific gust of wind knocked her sideways on the bike. Suffered some fractures, terrible road rash. One of the fractures was in the pelvis. And of course she couldn't run anymore. So the doctor told her, these were not the most severe fractures, but he told Candace that it would be 2 months before she healed. So in 2 weeks, she was back biking. She used enough awareness to know what she really couldn't do. But the arm fracture was enough she could bike, and the pelvic fracture would allow her to bike. And she's doing quite well because she already had a great deal of confidence in her ability to heal. This is not normal. I'm giving you an unusual example. But with awareness and with that confidence in her ability to heal, that's a tremendous factor. But let's go down to the real meat of what we're talking about here. How do we learn to access those inner resources so that we can be resilient and have a quick recovery, which is exactly what we want? So Moshe, I'll give my own example. I fell off a roof a number of years ago, broke an ankle, and during the time that I was dealing with that broken ankle, I developed a movement pattern. I didn't know that, but I developed problems with my knee. I went to physical therapy. I was already very strong at that time. And actually the first physical therapist I went to made it worse. How could that be? Well, you just go in the wrong direction and that's easy. The second physical therapist I went to was not only an ultra runner, but he knew a little bit about the Feldenkrais method. So here's one of the major secrets in recovering quickly and in the Feldenkrais method, and that is that movement comes before strength. So what I had developed was actually an inefficient and harmful movement pattern that didn't allow my knee anymore to cooperate with my hip and that ankle that previously was broken. Learn a little bit about that, and you're on your way. So the quality of our movement is something that anyone can learn about, especially if you see a Feldenkrais practitioner to get you started. So the movement is more important than strength, because if you do a movement well, you will be strengthened in the function that you need to be strengthened in. And it will allow you to do that function because of good use of the joints and the skeleton and the nervous system. It will allow you to do that function where nothing else could. And then the gentleness that can go along with that is also beneficial to something like recovering from surgery, because what you're trying to do is make fine differentiations, not just push through something. So this is all very hopeful. Resilience is the ability to recover quickly and well. And the idea of if you know what you're doing, you can do what you want is so true and so hopeful. So there is a way for us to relatively easily access those inner resources that will make for a quick and full and easy recovery. So thanks for bearing with that explanation, and blessings on your road to recovery.